As the virus spreads to more and more countries, the CDC expands travel alerts. And Meg Tirrell has more on that tonight. Meg?
Well, hi, Tyler. These new travel advisors coming yesterday from the CDC for Japan and Hong Kong. The health agency designating them both Watch Level 1. Now, that's not a recommendation to limit travel, just to be aware of reports the novel coronavirus is spreading in those places. Additionally, the CDC added notifications about the coronavirus for Singapore, Vietnam, and Thailand. None, of course, as high as for mainland China, a warning of Level 3 to avoid non-essential travel. Former FDA Commissioner Dr. Scott Gottlieb told me today outbreaks in neighbors of mainland China, particularly Japan, South Korea, and Hong Kong, are, quote, the new front lines for this disease. Public health experts are watching these areas closely as case counts rise. In South Korea, numbers more than doubled today. Meanwhile, Iran now confirming 5 cases and 2 deaths, prompting the country to close schools and impose emergency measures near its capital. Joining us now is Helen Branswell, senior writer at Stat News, who covers infectious diseases and public health, and Dr. Ali Khan, Dean of the College of Public Health at the University of Nebraska Medical Center. Welcome to you both tonight. Dr. Khan, I'd like to start with you. Just looking at those neighbors of mainland China and the increasing numbers of cases we are seeing there, what does that tell you about the trajectory of COVID-19?
I think what we're seeing is the world has a front row seat to how public health works and how they're dealing with the novel and unpredictable virus. Fortunately, of the countries that you just mentioned, Japan, Singapore, South Korea, they have excellent public health systems. And we're seeing how they're sort of layering multiple public health measures. Currently, a lot around about finding people who are infected, finding their contacts, doing targeted quarantine of those contacts. So we're fortunate that they have excellent public health systems to try to deal with the threat within their country.
Well, Helen, I want to ask you also about the methodology of counting cases in China. We have now seen it change multiple times. You wrote a great piece today about the confusion over the case count. And of course, you've been tracking this graphically. So we saw a huge spike last week with one change, another massive drop this week with another change. You've been covering infectious diseases for almost 2 decades. Have you seen anything like this before? And what does it tell you?
Well, it tells us it's a very confusing situation. I mean, the case definition, the way they're deciding whether someone is a case or not, has changed multiple times in this outbreak. In fact, I think it's up to 6 now. And that's normal. You need to be able to amend your case definition to, as you learn more about a new disease. But last week, as you mentioned, they decided to include people who hadn't tested positive, but who had had a CT scan that showed pneumonia and had symptoms of the disease in Hubei province only. And then there was a 15,000 case jump in one single day. Yesterday, they said they're revising that, and they knocked a bunch of cases off the case count and reported 340 or 94 cases yesterday. I guess 411 today. It's almost it gives you almost whiplash. It's unusual to see cases react so quickly like this, and it makes people wonder what's actually going on.
Dr. Khan, may I ask a question about transmission and whether it is truly practical in a free society to arrest transmission of the disease? In other words, in China, they can close down Wuhan and Hubei and shut the doors so that people can't move. But you can't do that in the United States and in other free countries.
So I think the best way to answer that question is go back to the basic virology. So these diseases, many of these diseases are in animals. They routinely jump or spill to humans. And in some cases, they can cause prolonged person-to-person transmission. We see that with plague. We see that with avian influenza. We see that with SARS, MERS, but that doesn't, and Ebola. But that doesn't mean that they don't go back to the wild. So it's very reasonable to consider, until this disease declares itself, that you can try a containment strategy. The containment strategy worked very well in 2003, and so it's very reasonable, again, for countries at least to try a containment strategy. If nothing else, it gives them time until they develop better vaccines, better drugs, and beef up their public health systems.
Helen, I want to ask you about your interview with CDC Director Dr. Robert Redfield. You published a great story last week after you spoke with him. Tell us about what he told you about how and when, what would cause the U.S. to change its approach.
He was talking about the fact that, for one, the CDC expects to see some transmission in the United States. It expects this is going to be around for a while. It may be something that subsides a bit in the summer, depending on whether or not higher temperatures bring down transmission levels, but that it might come back in the fall and next winter. He was suggesting that, you know, at this point, people still want to go for containment, the idea being that if possible, this virus should be driven back into nature, and in the way that SARS was in 2003. But that he said that if it got to the point where there were 4 generations of spread seen in a couple of different locations in the United States, in different parts of the United States, then at that point, the suggestion would be that it would be time to move to mitigation.